causes an affectation in the quality. Introduction. The disability causes an affectation in the quality of life and restrictions of access to education. It is well known that children and adults with disabilities generally have health difficulties, poor educational performance, fewer economic opportunities, and greater poverty in their adulthood compared to people without disabilities, as assured by the World Health Organization (WHO). Consequently, an economic and social problem called cost of disability can be pointed out. Robotics is a field of engineering that can contribute to solving this problem. This field has been extensively developed and is being applied in a great diversity of scenarios and human fields of action, as has been the case in the field of rehabilitation. In the last decade, automated devices used for neurorehabilitation have been altered in order to improve limb function in people who have undergone traumatic injuries or have congenital or neurological disorders. The human hands are very complex and versatile. Research shows that the relationship between the hand function and the ability to perform ADL is stronger than the other limbs. The deficit in hand function would seriously impact the quality of patients' life, which means more demand is needed on the hand motor recovery. However, although most patients get reasonable motor recovery of proximal upper extremity according to relevant research findings, recovery of hand functions has been limited due to low effectivity. There are two main reasons for challenges facing the recovery of the hand. First, in movement, the hand has more than 20 degrees of freedom, DOF, which makes it flexible, thus being difficult for therapist or training devices to meet the needs of satiety and varied movements. Second, in function, the area of cortex in correspondence with the hand is much larger than the other motor cortex, which means a considerable amount of flexibility in generating a variety of hand postures and in the control of the individual joints of the hand. The benefit of this proposal is to use the results to prove that medical therapies involving repetitive movement allow the rapid establishment of affected neural connections. This system allows you to automate and optimize therapies, making them more intensive and decreasing the labor required of therapists in hand function training. The Robotics has been defined as the application of devices with electronic or computerized systems designed to perform human functions. A therapeutic robot is a system that detects the user's movements, uses this information to adjust parameters, and provides visual and sensory feedback to the patient. In itself, it has been reported that they are non-invasive devices, easy to control, with little risk for the patient, and with good effectiveness for treatment. Robotics is one more tool in rehabilitation programs that allows increasing the intensity and quality of therapy. Although its development is advancing by giant steps and the results are very favorable, the success of the therapy requires clinical knowledge to identify which technology should be applied to each patient at each moment and how to make use of robotics to provide therapy based on the principles of motor learning, biomechanics, and neuroplasticity. Robotic rehabilitation devices, along with conventional therapy, provide a tremendous amount of benefits to clinics and patients, and are a solution for today to meet the challenges of tomorrow. Hand functional rehabilitation robot. The hand rehabilitation device designed to help with hand dysfunction caused by stroke, hemiplegia, cerebral hemorrhage, cerebral infarction, peripheral nerve injury of hand, orthopedic surgery, spinal cord injury, hand burn, children's cerebral palsy, etc. Low self-esteem and high levels of frustration are common among people with hand motor impaired disabilities due to their inability to perform everyday tasks. Something as simple as picking up a phone, tying a shoelace, or fastening a blouse can be overwhelming and adversely affect the quality of life we all deserve. The artificial intelligent hand rehabilitation robot combines flexible robotics technology and neuroscience. It uses flexible pneumatic bionic muscles as the power source. By repeatedly driving the bionic muscles on the gloves to expand and contract, the gloves can pull the fingers to drive the joints of the affected fingers. Helps you to do flexion and extension exercises. How this robot works. It is associated with the basic mechanism of improving motor function after stroke, or any kind of brain insufficiency resulting in neuroplasticity. It is a term that refers to the brain's ability to modify the physical structure and function throughout life, and in response to experience and training. One important goal of rehabilitation of stroke patients is the effective use of neuroplasticity for functional recovery. Therefore, high-intensity practice and repetitive training are required to help the patient's brain to relearn the ability to move, making stroke rehabilitation a labor-intensive process. Before we dive into the details of neurons and the neural pathways, you should know some basic anatomy and physiology of hand, to understand the mechanism of action of this device better. Hand. The hands are two important parts of the human body, prehensile and with 5 fingers each, located at the ends of the forearms. They range from the wrist to the fingertips in humans. They are the main organ for the physical manipulation of the environment. They are the main organ for the physical manipulation of the environment, which is why the sense of touch is immediate endings in the human body. They are the main source of tactile information about the environment, which is why the sense of touch is immediately associated with the hands. As in the other paired organs, eyes, ears, legs, each hand is controlled by the cerebral hemisphere on the opposite side of the body. There is always a dominant cerebral hemisphere over the other, which will be in charge of activities such as manual writing, handling utensils when eating, among others. In this way, the individual may be left-handed, if the predominance is of the left hand, or right-handed if it is of the right hand. This is a personal trait of each individual.